Good morning, good afternoon, good evening, wherever you are. I'm Dr. Mark Di Pasquale from Adjusted Family Chiropractic in Melbourne, Australia. And today we go through the mind-body connection, manage the depression and anxiety associated with chronic pain, and holistically and concurrently. So this presentation here, I hope you and those close to you will benefit from this information. Here it is. Here is the document. We'll just go through it today. Now, just a note also that there is some research quoted in this report, and it may capture studies done in other parts of the world, so they may not be 100% accurate for our Australian population, but they will be close. Our health statistics are similar to other Western countries, and we should take notice and benefit from any insights. If we as a country do all our own research, it will take too long and cost too much money, and literally our population is too small for large studies. So here it is, and this paper, in this paper, we describe the association between physical pain and mental health, and how treating the two concurrently through chiropractic care and cognitive behavioral therapy and other evidence-based mental health treatments can deliver more optimal outcomes. We also urge healthcare providers to embrace holistic management of the patients at all conditions are treated. So, a bit of background. Chronic pain and depression are two significant economic burdens in the US and elsewhere in the world. Back pain and lower extremity pain account for more than $2 billion in annual healthcare spending. More than a quarter, 26.4% of American workers experience low back pain over any 3-month period, which contributes to absenteeism and lower productivity. Meanwhile, a recent report from Mental Health America, the MHA, shows that Americans with moderate to severe symptoms of depression and anxiety increased throughout 2020 and is higher than before COVID-19. However, even before the pandemic, 19% of adults reported experiencing a mental health condition, according to the MHA, up 1.5 million people from the previous year. The economic burden of major depressive disorders in the United States increased by 21.5% over the 10 years studied, with 45% attributed to higher direct medical costs. For every dollar of direct cost, an estimated $6.60 was spent on comorbidities, workplace costs, and suicide-related costs. Finding the right pharmacotherapy for depression is often challenging due to intolerable side effects or lack of efficacy. It is estimated that each patient with depression who is prescribed 3 or more different medications cost $21,259 for commercial health plans and $20,964 for Medicare. Most recently, a study of US patients published in 2023 showed significant associations between back pain and major depression, while a longitudinal analysis found that back pain preceded major depression at follow-up and vice versa, suggesting that one condition is contributing to the other. While little research has been conducted on the economic impact of patients with both back pain and depression, abundant research has shown how the two conditions are often comorbid and likely influence a patient's perception of their mental and/or physical health. Likewise, given the impact of back pain and depression separately, the economic impact of these combined conditions would be significantly greater. Depression also heightens, or one could contend, distorts the patient's perception of pain. In turn, symptoms for both conditions are perceived to be worsening. For example, a nationally representative survey found that nearly 2/3 of patients with pain and depression, 65.1%, reported poor health significantly higher than those surveyed with neither condition, and were more likely to report functional limitation. Patients with chronic pain may be prescribed opioids against prevailing clinical guidelines, which further contributes to their depression, as well as their healthcare services utilization. Opioids have been shown to significantly increase a patient's risk of depression, even in patients without a history of the condition. Even worse, patients with depression or anxiety typically require stronger opioid dosages to manage pain and report less relief than patients without mental health conditions. With pain and depression so closely linked, it is logical to treat conditions concurrently. Moreover, exploring non-pharmacological management methods for both would also seem in the best interest of the patient, healthcare system, and the economy. Too often, depression and chronic pain are managed in isolation. In some cases, both are managed with psychiatric drugs, or one condition is untreated. This scenario can result in a one step forward, two steps backward dilemma, where progress with one condition is inhibited by lack of symptomatic relief in the other condition. As a result, the patient may abandon management of either condition or self-manage through misuse of opioids and other substances. So we move now into solution. Expanded access to affordable, drug-free physical and mental health therapies is essential to safely manage both conditions. Providers should design holistic care plans that, in collaboration with other clinicians, treat the patient's comorbid conditions and help them find relief while avoiding the safety risks, side effects, and costs associated with pharmacotherapies. Doctors of chiropractic, DCs, who for more than a century have taken a holistic perspective and practice drug-free pain management methods, need to lead the industry in this shift. Since its founding in 1895, chiropractic care has represented the biopsychosocial philosophy of health rather than a biomedical one. DCs believe that optimizing physical and mental health comes through proper nutrition, constructive exercise, stress management, and a focus on the importance of good posture, as well as proper spinal and extremity joint biomechanics. A growing body of scientific evidence has demonstrated that spinal function impacts central neural function in the spinal cord and brain in multiple ways. Improving spinal function results in positive clinical outcomes, not only in enhanced spinal motion and pain reduction, but also in improved sensory and motor nerve processing, termed sensory-motor integration. Scientists have known for decades that neurons, nerve cells, continuously adapt in structure and function in response to stimuli from our ever-changing environment. And when the nervous system is subjected to unaccustomed sensory inputs, this changes the way the system processes all subsequent sensory inputs. This ability of the nervous system to change and to reorganize its response to stimuli has been termed neuroplasticity and has informed recent research concerning musculoskeletal pain management. As researchers are discovering, back pain is not caused by structural problems in the spine alone, but rather the relationship between the spinal dysfunction's effect on the nervous system and sensory motor integration. Pain's interconnectedness with other nervous system activity is believed to be why chronic pain is often comorbid with other conditions. The nervous system's influence over a growing list of diseases is also why so many patients who receive chiropractic care report positive outcomes in addition to pain relief. In fact, in a small study, patients who received just one spinal manipulative therapy, referred to as an adjustment by chiropractors, showed improved sensory motor integration in the prefrontal cortex in the brain as measured with specialized equipment. Therefore, authors contend that the mechanisms behind pain relief following spinal manipulation are likely due to improved sensory motor integration and appropriate motor control, which is a function of the prefrontal cortex. DCs deliver nearly 97% of adjustments in the US, according to a recent analysis of claims data covering a 12-month experience in a national commercially insured population. So the link of chiropractic and depression. Chiropractic care's effect on nervous system may also explain why it helps patients better manage their depression. Symptoms of depression such as high cholesterol, high adrenaline, insomnia, agitation, and anxiety can be attributed to overactivation of the sympathetic nervous system. After reviewing studies, researchers in 2020 determined that spinal manipulation may activate the parasympathetic system to counterbalance the activity of the sympathetic system and thus reduce depression symptoms. Stimulating the parasympathetic system is also considered an effective therapy for major depression as it releases neurotropins essential for antidepressive therapies, including brain-derived neurotrophic factor and nerve growth factor, according to researchers. Despite chiropractic care's positive impact on depression, a DC should not only be the only provider involved in managing the patient's mental health condition. A mental health professional's involvement and a therapeutic relationship with the patient are often essential. Cognitive behavioral therapy, or CBT, which involves exploring the root causes of patients' feelings and developing skills to challenge negative thoughts, is a highly effective method of managing depression and aligns well with the DC's goal of correcting the dysfunction instead of treating symptoms alone. CBT on its own has also been shown to help patients manage physical pain by reframing the experience and focusing their mental energies on activities that alleviate pain and challenge negative thoughts, such as catastrophizing. Catastrophizing, a common symptom associated with both pain and depression, is the recurrent thought for patients that there will never be an improvement in their condition. Their condition is worse than others, and they will feel this way for the rest of their lives. In a study of 1,331 US veterans with chronic pain, cognitive behavioral therapy, CBT, significantly reduced their pain catastrophizing, as well as pain intensity, pain interference with daily activities, depression, and improved their physical quality of life. Similarly, nearly half, 47% of a group of patients with chronic low back pain who were referred to a chiropractic clinic experienced a significant decrease in pain after 1 month and an improvement in depression symptoms after 3 months of care. Combined, chiropractic care and CBT or other types of evidence-based mental health therapy could maximize the efficacy of both treatments, all without ineffective and potentially dangerous pharmaceutical drugs. While seeking help for physical pain is routine in our culture, the same cannot be said for the lingering social stigma surrounding mental health care, particularly among men. These attitudes are particularly tragic, considering men are more likely than women to become dependent on drugs and alcohol and commit suicide, both of which are deeply associated with untreated mental health conditions. Fortunately, numerous organizations are attempting to change mental health beliefs and attitudes that influence our culture. Same Here is a global advocacy organization founded by former sports executive Eric Cuson. Cuson's group recruits athletes, celebrities, and experts in mental health to change the global conversation and influence others to open up about their challenges. For years, Cuson worked for the National Basketball Association and held senior management positions with several professional teams. Due to unresolved personal life traumas at a younger age, life experiences he was unaware were affecting his mental health. Cuson developed severe post-traumatic stress disorder, along with symptoms of anxiety and depression. For more than 2 years, Cuson barely left his bed and received numerous psychiatric drugs, as well as transcranial magnetic stimulation and electroconvulsive therapy treatments. Eventually, Cuson overcame his most debilitating symptoms and emerged from the dark episode in his life to launch Same Here. An episode of Foundation for Chiropractic Progress's Adjusted Reality podcast featuring Cuson discussing his mental health journey is available. One of the athletes and experts Hewson recruited is Theron Fleury, a former professional hockey player, Stanley Cup champion, Olympic gold medalist, and mental health advocate. Fleury revealed in his 2009 memoir, Playing with Fire, that he was sexually abused for years as a teenager by a former coach. The trauma combined with a chronic home life contributed to Fleury coping with his mental illness by abusing alcohol, drugs, gambling, and even contemplating suicide. Now in recovery for years, Fleury is a motivational speaker dedicated to helping others discuss traumatic experiences in an emphatic and supportive environment. Fleury's story and inspiring perspective on managing childhood trauma and addiction was also featured in an episode of Adjusted Reality podcast, also available. Hewson Fleury and many others advocating for a world that embraces professional care for mental health the same way it does for a physical health condition. A chiropractor can contribute to this culture change by screening for depression or other mental health conditions and then refer patients with their consent to a mental health professional in their provider network. An older study recommends this protocol for DCs, with authors concluding, there is sufficient evidence in the literature to demonstrate a requirement to draw treatment options from many sources in order to achieve a favorable pain relief outcome. The treatment should be multimodal, including mental and emotional support, counseling, and herbal advice. Exercise too has reached clinical consensus as an effective tool to include in a pain and/or mental health integrated care plan when feasible. A systematic review of more than 1,000 trials published in 2023 found that the health benefits of exercise were found among a wide range of mental and physical conditions, including depression, HIV, and kidney disease. The study authors concluded that physical activity should be a mainstay approach for managing mental health. So in conclusion, pain and depression are inextricable from each other. Combined, the two conditions, if left untreated or managed in isolation, drive up greater healthcare costs, reduce the efficacy of separate treatments, and decrease the patient's quality of life. Chiropractic care has been shown to help patients find relief from both their neuromusculoskeletal pain and debilitating mental health conditions. For optimal outcomes, however, doctors of chiropractic should refer patients to mental health professionals for cognitive behavioral therapy and related care that can help relieve depression or anxiety symptoms. The mental health professional can also help patients build skills to cognitively manage their physical pain, focusing on their chiropractic care, as well as exercise, sleep, nutrition, and other lifestyle changes can help them find relief from both conditions and improve their overall well-being. So I hope you found this paper beneficial. If you would like more information on this topic, or if you have any questions, please contact me. And bye for now, and have a healthy day.